Welcome. The relationship between mothers and medicine has always been more than a medical specialty for me. As a young girl, it was my mother who told me, "You're going to be a doctor when you grow up." I considered rebelling with a career in economics, as I was great in mathematics, but in the end, I wanted to devote my life to infants and not inflation. And today, together with other researchers, I'm working on life-saving tools to help mothers and babies thrive. The medical community now knows the time to start caring for a child isn't when they're born, it is before, in their mother's wombs, during pregnancy. But as we all know, when a woman is pregnant and poor, there are many barriers to getting antenatal care. It's hard to access, and if you do, there's a good chance it will be of low quality. There are two promising interventions that can make a difference in these scenarios. The first tool centers on fighting malnutrition. If a mother is malnourished, her baby is as well. More than 1 billion women and children don't have access to good nutrition and healthy diets around the world. A common solution are supplements and vitamins, which are easily accessible in wealthy countries with countless choices. But in low and middle-income countries, there are limited options, and the few supplements that are available are costly and still lack all the necessary nutrients to fight malnutrition. But this big challenge can be addressed by this small bottle. Well, it doesn't look so small, but it is small. Multiple micronutrient supplements, or MMS, are an intervention that could help millions of pregnant women. They contain 15 essential vitamins and minerals, including folic acid and iron. They are easy to use, low cost, and ready to scale. Most importantly, they work. In current studies, MMS significantly reduces the risk of low birth weight by 12% and very low birth weight by 22%, both of which are factors in infant deaths today. In today's world, we ask women to take iron folic acid tablets, which are poorly tolerated, often thrown away, and address only 2 nutrients. In my country, Nigeria, and others, including Pakistan and Ethiopia, researchers are working hard to bring this support to all pregnant women. Make no mistake, these supplements represent more than just help. They also represent hope, because the solution is finally being tailored to solve malnutrition in communities that were overlooked for far too long. Interventions that address nutrition during pregnancy need an assessment of the pregnancy itself, and the tool that helps us do this is the ultrasound. But for many who are pregnant in poverty, the nearest ultrasound is far away from their homes if it's there at all. And standard ultrasound systems are expensive, can't travel outside of the clinic, and require trained or certified technicians, radiologists, or obstetricians to operate them. But that could all change thanks to this second innovation in my hands. It's a handheld, portable ultrasound machine. As you can see, it's about the size of a phone or water bottle, and it plugs into smartphones. Images can be captured with the handheld probe and sent to other medical professionals for a review through a simple app. And most importantly, because of its portability, this device can be used outside of the clinic, reaching even the most remote patients. And they're about 1/20th the price of a regular ultrasound. They're also aided by AI, which means you don't have to be a fully trained radiologist or obstetrician to figure out how to use it. You sweep the probe along the woman's belly, and the AI does the rest. I mean, I heard even Bill learned to do it the other day. The results can give a nurse or midwife signs that the baby may be growing poorly or at risk for early preterm delivery. We are now validating such systems and seeing that they perform even better than the experts. Having access to these 2 tools could mean more timely diagnoses and interventions, and fewer risks and complications for both a newborn and mother. This brings me to healthy births, which are also a major focus of my work. As mentioned earlier today by my colleague, Professor Hadiza Galadanchi, one of the major causes of maternal mortality is postpartum hemorrhage, which is also known as PPH, that is severe vaginal bleeding during and after childbirth. A new mom can lose more than a liter of blood within a few minutes of childbirth. Another intervention, which is dear to my heart, benefits PPH, as well as the woman's well-being, the infant's brain development, and even the bond that mother and baby make after birth, because it addresses anemia. Anemia is a common diagnosis for women in lower and middle-income countries, reaching as high as 80% in some communities. One common remedy for anemia is iron through supplements. But often, this regimen requires an expecting mother to take 2 to 3 pills a day for a minimum of 4 weeks, depending on her needs. I knew that there had to be a better way, one that makes the process less burdensome and unlocks the potential to help more women. And here on this stand is where the journey has led me and my team. It's a promising solution we call IV iron. It's used in other parts of the world. It's a one-time 15-minute intravenous infusion that anemic women can get in a simple clinic. This can replenish women's iron reserves during pregnancy or even after pregnancy, as it could help treat cases of severe anemia quickly and effectively. And for women with anemia due to a lack of iron, it can give the body all the iron the baby will use. Broader access to this would allow mothers to focus their time on their well-being and that of the growing child inside them, and will reduce the risk that will stop the newborn from coming into the world safely. Yet another innovation to ensure healthy births helps track a mother and her fetus's status and vital signs. In a high-income medical facility, it's standard care to use monitors to check on the mother and her fetus during labor and delivery. They measure things like the oxygen saturation, the heart rate of both the mother and the baby, and contractions. The typical monitors used are costly. They tether a woman to the bed, and if overused, can result in increased cesarean sections. Conversely, in low and middle-income country settings, these sensors are rarely used, making it difficult to identify risks and give women the care they need. But new innovations like this Intrapartum sensor are low cost, wearable, and not confined only to tertiary care facilities. They can be printed at scale, use Bluetooth to communicate, and integrate maternal and fetal data to provide a complete picture of how labor is progressing. And even though they look really, fantastic and space age, they are actually things that can be used anywhere. Especially where births are shifting from homes to facilities, these help my colleagues and me understand which women may need referral to a higher level of care. As more innovators work on this, we can imagine a world where we can bring these low-cost sensors to women at home or wherever they are outside of a hospital, using AI and the internet to keep doctors informed. It's inspiring to see new tools in research and testing that could have a huge impact on keeping mothers safe during childbirth. That is a world that excites me, and that is a world that mothers deserve.